we'll go ahead and get started with today's session. After those housekeeping announcements that we just made regarding questions, I am ready to turn it over to you, Val.
Okay, thank you, Heike. I double pushed the button. Sorry. Good morning, everybody. Just real quick, I am concerned. I'm concerned about the number of positives. I am concerned about what we're learning now that we've started some open air case management visits. I am concerned. I'm concerned about what I'm seeing in event reports. So I'm starting off with that so that you understand where I'm coming from as we go through these next 10, 15 minutes and I do some talking here. To give you an idea about cases in the state of Missouri, on June 19th, we were seeing 293 COVID positive cases a day. We had accelerated testing at that point. Today, on July 9th, we have 25,000, or yesterday, we had 25,999 positive cases in the state. In June, amongst our DD community providers, we would see one case every day, every other day, every 3 days. We are seeing 6 cases a day. We also are very confident that not all cases are being reported to us. We are hearing from, so if you have a case, report it. If you know of a case and you have some responsibility for that individual services, report it. If it gets reported 6 times, I am totally fine with that because I cannot box in and I cannot keep people safe if I don't know where there is an outbreak. And we consider an outbreak 1 positive staff, 1 positive resident. So I can't help you if I don't know where they're at. And I will tell you, reading the event reports this week, starting those open air case management visits, starting those pre-planning calls with providers, we have learned a lot across the state. So I'm not sure how that looks in the future, but that pre-planning document definitely is probably going to be around even if you're in a remote area. Those are questions you need to be asking individuals, okay? To give you an idea, right now we have 71 cases of individuals that are in the community that we know of that are accessing services. We've had 16 new cases in the last week. We're getting 6 new cases a day right now. We actually had 7 today. And again, those are the ones we know about based on what we're reading in the event reports. Some of those should have been reported to us long ago. Some providers don't feel it's their responsibility to report anything to us. And I'm not going to debate whose responsibility it is. I'm going to say, please, for the safety and security of the individuals we support, if you are aware of a COVID positive individual, follow our reporting process online. If I get it 6 times, I will jump for joy, okay? So let's please, please, please make sure we understand that because we can't help folks if we don't know where the issue is. Also, we know that county health departments are advising folks that if you are a contact of someone who is COVID positive, that you do not need to seek testing unless you have symptoms. We are following up and saying that is fine, but we are here to get you tested if you want to be tested. We do that because the individuals that we support often live with other individuals who are going to be at high risk for bad consequences of a COVID positive test, okay? And so that's why we want to test as many people as possible. Also, we know that the individuals that work for us work at a lot of different places too. So we want to make sure that we can get that testing available for our staff, for the individuals that we support, and then that also gives reassurance for our staff with their families. And they will come to work if they have that reassurance. So when we call you and say, would you like us to help support you get testing? Please say yes to that question because we really are only making those calls in places that we really think it's important for people to get a test completed. All right. Moving on, we have started flu planning. So, and we'll be doing a lot of reaching out, probably doing a couple quick provider surveys just to understand what we do around influenzas, what providers are doing around vaccinations and supporting individuals to get those flu influenza vaccinations. So we have started that at the department level. expect more information to come out. I know a lot of you probably already have your influenza plans. Now's the time to get it out, take a look at it. If you've got questions, you think, you know, we've always done it this way, but what about this way? Let us know and we can help you work through those. Also, next week, the Department of Health and Senior Services is going to be putting out a new reporting tool for individuals, and we will share that with you when that gets put out. Right now, we're reporting probably 3 or 4 different places, hopefully, and we will have to continue to do that for a while, but hopefully this new reporting tool from Health and Senior Services can help us replace a lot of other reporting tools that are out there. That is our goal. We are going to have to do duplicate for a while because we have got kinks to work out, because you don't create a system in June, have it ready to go by August, and have it perfect. And so, but we want to get it out there and people starting to use it. Testing updates. So I just talked about testing. I have concerns about, not concerns, I am happy that we have individuals accessing the community. I am grateful whenever they have a test, it's identified them as a positive, even if it's an asymptomatic positive. I'm grateful that that test was available for them. I'm grateful for the providers that continue to support them. But one positive comes from somewhere else. And so one of the things that we do and that we're supporting providers to do is to get facility-wide testing done and then to continue that testing on a surveillance basis. What we do at the state is 10% a week for our congregate care facilities, but you could do 10% a month, just some sort of surveillance testing. This week alone, we have stopped 5 outbreaks because of surveillance testing. So think about that. Testing matters. Testing makes a difference. I cannot say enough about it. I will tell you right now, there are struggles with lab capacity in the state. We were notified by one lab that they are out of test kits, so they cannot support our facility testing until next week. So we will move to another lab. We have been notified by another lab that they have no reagents, so that they can't actually run the test. So we will be working with another lab in the interim to address our testing needs. We are also reevaluating the level of surveillance testing we're doing to ensure we have enough tests to do the outbreak testing that we need to do. I don't know that that's a long-term issue. I think that's a short-term issue that we're getting resolved at this point, but the lab capacity is an issue. For those of you that are working with the SQHCs right now on your testing, we know that we are working with them to identify alternate lab capacity, alternate lab solutions. So someone said, if you don't get a test result for 10 days, does it still make it worth knowing? It doesn't help you for those 10 days, but it still helps you for those days after that. It helps you to know what individuals you need to be watching. If you need to continue quarantining, it helps you with a lot of information. So I don't really have anything new on the budget front. We've pushed everything out. I know we have a few staff that will be notified of layoffs today. So for staff that are on the phone listening, if you don't receive that, there are very, very few. If you don't receive that notification, you are not impacted by this. CARES Act update. I know on Wednesday, CMS did another webinar on how to get the provider payment relief fund money for Medicaid-only providers. So again, we don't have anything to do with that. We're strictly just passing on the information from the federal government, making you aware of potential funding streams that are available to you. I know people continue to call and ask us questions. We don't know the answers to those. You will have to do those on your own. But those webinars, I'm sure that webinar was recorded also. So we also are getting a lot of questions about case management. I'm just going to read this one. Just because most of the questions we get really fall into this category. So it's not because I picked this one specifically, it's just because I think it encompassed everything and that we're getting all of the side questions we're getting. The question had to do with how much flexibility case management providers have to begin even the open air distance visits. I think it's been confusing that it was an individualized organization decision based on local numbers. We kind of talked about that to begin with, so I do apologize for that. But we've learned that what we're doing now is we're making that decision at the state level, and we're posting, and we look at those numbers every day. I know several of you have sent in questions as to why your county is or is not remote. We've added counties. We've looked at counties specifically based on what you sent us, so thank you for that. It is going to be a state decision at this time. Like I said, 1 week in, I cannot tell you how valuable I see these open air visits. I also consider this to be a very low risk activity. Going to the grocery store is higher risk than doing an open air visit that's planned for when you're wearing a mask, when you know you can guarantee social distancing. So I just want to make sure that people are thinking about it that way. Okay. So some more follow-up on that. I know another question we got around that was if areas have mask ordinances, doesn't that make it kind of unsafe for us to go out? Masking is a preventative measure. It is not a reactive measure. So masking is not a reason not to do a visit. Masking just makes it safer to do a visit is what it does. A reactive measure in a county is when a county starts doing countywide testing because they can't do the contact tracing to figure out where outbreaks have come from. That's a reactive measure. Those are the things that we look at to consider on moving area to remote only. So just keep that in mind. But the requiring of mask is a preventative measure, and it's something we've been preaching since March. And even as we were talking about getting individuals out of their home and back out into the community, it was, can they wear a mask or not? So let's remember that specifically. Remember that support coordination is contracted out as an extension of our state's requirement for oversight, and it provides several waiver assurances. We have a need to implement monitoring consistently statewide. And again, our Seymour event reports are showing us the value of this starting back up just 1 week, okay? TCM agencies do have the flexibility to determine with providers how to implement your open air visits. Like someone can sit inside, someone can talk on the phone, but I will tell you, when you see someone face to face, it is a whole lot different. And I know you guys have done remote visits successfully, but you only see what they want you to see in a remote visit. Whoever's holding the phone, who's ever holding the camera, who's ever holding the computer, however you're making that communication happen, you still only see what they want you to see. We don't know what's going on the backside of the camera, and that's been made relatively clear to us through Seymour event reports this week also. There was also some concerns about the time of the year and the heat. And you know, when we have a snow day, you have a snow day. You write down didn't complete visit because we had snow. Okay, that is fine. If it's 105 degrees, don't go sit outside at 1 o'clock in the afternoon. It was 72 this morning across most of Missouri up until about 10 o'clock. So a lot can happen between 8 and 10 a.m. A lot can happen between 6 and 8 p.m. So again, we ask you to be creative whenever we're working on doing this. It is a vital, vital function that we have. Let's see. I think that's all I had on that. Oh yes, that pre-planning tool I think has really, and we're open for more suggestions on how we want to kind of use the same pre-planning tool across the state, but we are open to suggestions or questions that we think would be more helpful on that pre-planning tool. Okay, with that, I'm going to turn it over to Wendy.
All right, and I just want to follow up what Val was talking about there to let folks know that we're going to be working internally with our TCM TAC team, and we will be including some TCM providers, some MAC providers on making sure that we have consistent guidance for our TACs in reviewing and monitoring our transition to open air visits consistently across the state. So we will be working on that in the days to come. So one thing I wanted to mention is that the staff stability survey the deadline has been extended by NCI. We now have until the end of August to submit our responses, and I please encourage you to do that and to pay attention to that. We've had really good response the last year and the last couple years, had statistically significant response rates, which is huge. It is huge for us to be able to know what is going on in terms of staff wages and benefits and what's being implemented across the state of Missouri. It's huge for all of you to have the information for advocacy efforts. It gives you comparisons within the state of Missouri, as well as, you know, nationally and with other states. So it's just really, really important, valuable information that we find ourselves using throughout the year. So please take some time to fill out that survey. We truly appreciate it. And then I just wanted to touch base on another question, and it kind of comes around our whole monitoring issue. And the question is around what are we going to do to require providers to have the technology in order to do remote visits through Zoom or through some other sources. Not everybody has a Zoom meetings. In some cases, it's felt that it is they're kind of being avoided, and so these are leaves us with very uneasy feelings. So we're going to be working on that guidance as well, but in terms of coming up with a deadline. But I'm going to be asking that all of our internal staff, our regional office staff, are working to identify with our TCM providers who those providers are that don't have video conferencing capability at this time. Providers, we need to be working right now to get that capability in place. It doesn't have to start out that you've got a tablet or a phone or a computer with a monitor in every location. It could be something that you take from place to place and schedule and work that out and gradually work it up. We know that there is a cost involved in this, but this is the world that we live in now. And, you know, when we first started out, I remember naively thinking, oh, well, you know, we're going to close down for a couple weeks and we'll see what happens. And I thought, well, maybe it's 3 or 4 months. This is ongoing. This is ongoing. This is going to be with us for a while, and we're going to be in and out of being able to do in-person visits with video visits. So we have to have every single provider able to do a video visit in the event that an in-person face-to-face visit doesn't happen. So we will work with you on that, but that is going to be a requirement. And when we get, it's just preparatory also for the support coordination system. When that gets up and in place, providers are going to have internet access. They're going to have to be able to access our system and keep that updated. So these are all things that as a provider you need to be preparing yourself for and moving forward with. So I've got a question here. UR processing and director signatures are in excess of 10-day requirement. Please comment on resolving this issue or remedying this issue. Oh, okay. So that's really helpful to know. And thank you for letting us know that. And we will be working with our UR staff. I know that they're on the phone listening now, and we'll be working with our UR staff to get that resolved. We have to get our timelines met. This is money that providers have already spent to provide services to folks. We've got to get them paid. We're already struggling with rates and that equity and being able to get folks paid what the service is worth. We know that, but this is something that we actually have in our control. So we've got to get that resolved, and we will be working diligently to do that. If you could, and I don't know that it's a statewide issue, so if people could please let me know through the chat, or you could email me, but through the chat's fine, what regions we're talking about if you're having that issue. And let's see if I've made all my points. We will have guidance forthcoming on the video conferencing as well as the in-person distance monitoring on that. I know that there's some concern with that will be consistent across the state with how the TAC reviews go. So we'll be working to do that. So with that, I am going to turn it over to Gary.
So I have one thing to cover today. So we had a note from a provider who tried to use StationMD and they had trouble getting a prescription filled. That's usually an issue with the pharmacy. StationMD physicians are registered as prescribing physicians in Missouri, so they can write prescription in Missouri. If you run into a pharmacy that's having that issue, please let us know. StationMD will work with that pharmacy. So if you run into any issues like that, just please let us know and we'll work that out. So I know they're also getting licensed to practice in Missouri as well.
Yeah.
And with that, over to you, Kim.
Thanks, Gary. And I think we just can't stress and emphasize enough, please utilize that service. It's available to everyone, and we've had lots of positive feedback and stories on how great that service can support individuals. Just a few quick reminders to everyone. The information I'm about to share, again, is nothing really new. This is information we've been sharing since we've been having these calls, but just feel like at this point in time, as Val referenced earlier, it's really important for everyone to pause and pay attention to the strategies preventatively that we need to be practicing on a daily basis. First and foremost, from the individual perspective, the importance of individual planning and supporting individuals to have the necessary information and resources to make their decisions regarding community access and engagement is key. It has to start with the individual and with that planning process. Monitoring the COVID-19 case activity in the community is important. We've provided lots of tools and resources. They're posted out on the website. Reach out to your regional teams if you're needing further guidance on that. It can really help make those important individualized decisions and the agency decisions that we were talking about earlier. Continued preventative practices per CDC and DHSS guidance is ongoing. This has not changed. Things like hand washing for 20 seconds at least, using soap and water. If you're out and about and you don't have direct access to soap and water, use an alcohol-based approved hand sanitizer. Making sure that you're wearing the cloth face coverings when you're out if you're physically able to do so. Making sure that you're doing environmental hygiene in your homes and in your locations. Making sure that when you're out, you're keeping that physical distance, which is recommended to be at least 6 feet apart, and trying to do those open air activities right now when the weather is permitting. Working with individuals to make sure that they're able to conduct these practices should also be a factor in the decisions on regarding their individual level of access in the community and where they feel comfortable at this point. Also, ongoing communication with healthcare providers is crucial and important. It helps to make those decisions, especially if the individual has underlying medical conditions that CDC has provided a lot of guidance and information that could potentially place individuals at a possible increased risk for severe illness if they happen to contract COVID-19. Those are factors that need to be considered and weighed in and discussed for individualized planning. Can't stress enough, ensuring individual rights is necessary, and the division has ongoing posted guidance, even pre-COVID, in regards to due process, individual rights, and supporting individuals in that area on this very important subject. Also, individual and their support team members' knowledge of COVID-19 signs and symptoms is also extremely important, as well as having clearly written agency policies for support staff to follow and supporting those staff to be able to know what to report and how to respond to ensure individual health and welfare. Because again, when it comes, what it boils down to is supporting the individual through individualized planning to ensure health and welfare. The importance of ongoing health management for chronic health conditions, can't stress that enough. We've provided resources such as Station MD. Lots of healthcare providers are using telehealth, telemedicine supports right now. So really, that needs to continue. It should not stop just because we're in the midst of the COVID-19 pandemic. Can't stress it enough. I'll turn it back. Oh, and one other thing, we had a question come in around agency reporting of positive staff. The division is not requiring that agency staff positive COVID-19 cases be reported to the division. The only thing we're asking for is when we're working with agencies on testing efforts, if you reach out to us and want that support, we're asking you to provide us the count of positives. That's all the information we need to know.
Now, Health and Senior Services' new reporting tool is available for you to do it.
Correct.
But that is not up and running yet. So when that gets up and running, then that is where you would report your positive staff, okay, so that we know and so that we can figure all of that out. But as of now, our system wasn't really able to handle that.
Not designed for that.
The new DHSS system, that reporting tool that is going to be online hopefully early next week, that will be the way that you can report positive staff, which is important. So we want you to report those positive staff. So, but our system can do it. This system will be able to do it.
And we're going to continue for right now to ask you to continue to report in the Seymour EMT system, though, for positive individuals receiving services. So that will be the duplication that Val was referring to.
Right, and if 6 of you report that one person is positive because you found out, like I said, we're going to dance on the roof of the building because that's how excited we would be. So please, well, Wendy's not going to dance on the roof. She doesn't want to get up that high. We had a couple questions come in, so I'm going to try to address those. We did have a question on what if a county doesn't feel like they should start open air visits. And please email through your TCM TAC why you don't think that's a good reason. So, for example, yesterday we found out that there was an event in Macon, Missouri that seems to have pushed a large spread of COVID through that area. So that's the kind of information that sometimes you at a county are going to have before we have. So that information plus what we see going on with cases would help us make a decision on whether or not you would want to go to remote, whether or not we want you to go to remote-only visits or not. But we need, if you are aware of specific information in your area, like let's say you're the only county with the only grocery store for 3 counties, that's good information for us to have, then we know we should be looking at 4 counties for information, not just 1 county for information. So that's the kind of information you can share through your regional offices. They will share it up to us, and then we can look at the data, use that information to help make that decision. So that's kind of how you get that done. There was another question about signatures via phone. Nothing has changed regarding how signatures work. So what we've been doing all along, even if you have that in-person visit, we're doing that in-person outdoor visit to lay eyes on a situation. We're not doing it for the paperwork side of the business, okay? So everything on the paperwork side of the business can still continue as you've been doing it since March. There was another question about the wait list. Yeah, it's for real. It doesn't matter what your priority of need score is. We are on a full wait list. No one is getting residential services. No one is getting in-home services at this time. What do you do? I don't have a good answer for that, but I also don't have money to pay for it either. So it is not a fun place to be by any means. Then we had another question about thermometers. So we have some day hab providers that would like to access thermometers. I believe thermometers are available through the PPE process on Health and Senior Services website. So if you will go to that website, log that you need thermometers, those should be made available to you. We will double check that though and make sure, but I am pretty sure thermometers are part of our statewide PPE need that we have identified as a department. So we'll go, and I don't know that they have any, but that is how you get them if we have any, okay? And I don't think there was anything else, was there, Wendy? One more.
There was one question about if we do the pre-planning questions, if we're violating any HIPAA rules because of asking family. You don't need to know the names, you don't need to know the particulars. You're asking, is there anybody in the household that is positive? That is not a HIPAA breach. No. So.
And also, this is interesting just to we're not asking particulars, so that's not a HIPAA breach, correct. Second, negative COVID results are not protected by HIPAA because there's nothing to protect. So just wanted to share that with you as well. Okay, again, very concerned about the numbers, watching everything very closely. Be safe, wear your mask, remember all the prevention things. And we preach prevention at the end of every one of this call, and we will preach it again. Wear your mask, wash your hands, social distance, make good decisions. And thank you all very much for everything you do every day. I'm really sorry it's a bad budget time on top of everything else. Okay, signing off until next week. Bye.